Imagine this. Your kidneys are slowly shutting down, and you don't even know it. Kidney disease is often called a silent killer for a reason. It creeps in quietly, hiding behind everyday symptoms like fatigue or swelling. By the time most people realize something's wrong, the damage is already done. But here's the truth most don't know. Your body does send out warning signs. You just have to know how to read them. In this video, we're revealing 11 often overlooked signs that your kidneys may be in danger. Spotting just one of these could mean it's time to take action before it's too late. Before we dive in, make sure to subscribe and hit that bell icon. Your health could depend on it. Let's get started. Sign number 1. Noticeable changes in how you pee. Let's kick things off with one of the most obvious, but often ignored, red flags: changes in your urinary habits. If your kidneys are in trouble, your bathroom routine might start acting strange. Maybe you're going way more often than usual, especially at night, or maybe it feels like you have to go urgently. But when you get there, almost nothing comes out. On the flip side, you might notice you're peeing much less than normal, and when you do, the urine could be darker, foamy, or even have a strong, unusual smell. So pay attention. If something seems off with your bathroom habits, frequency, color, volume, don't brush it off. Start keeping track. It might just give your doctor the clues they need to catch something early. Sign number 2, pain or pressure when you pee. Ever felt a burning sensation or pressure while trying to urinate? That uncomfortable feeling isn't something to ignore. It could be a sign that something's not right in your urinary tract. In many cases, this points to a urinary tract infection, UTI. And while that might sound minor, it's not something to take lightly. If left untreated, a UTI can travel upward and infect your kidneys, leading to much more serious complications. You might also experience fever, chills, or even pain in your lower back or side near the ribs, a sign your kidneys might already be under attack. Sign number 3, blood in your urine. Let's be clear, if you ever see blood in your urine, even once, it's not normal and it's not something to brush off. Whether your urine looks pink, red, or even cola-colored, that discoloration could mean your kidneys are leaking blood cells into your bladder, which is often a sign of serious kidney damage. But that's not all. Blood in the urine can also be linked to urinary tract infections, kidney stones, or even bladder and kidney cancers. So yes, it's a scary symptom, and for good reason. This is your body throwing up a giant red flag. Sign number 4, foamy or bubbly urine. When your urine consistently looks frothy or bubbly, not just the kind from flushing hard, it could be a warning sign that your kidneys are struggling to do their job, especially when it comes to filtering protein. Normally, protein stays in your body, but when your kidneys are damaged, it can start leaking into your urine, creating that foamy appearance. And yes, a lot of these symptoms show up in your bladder first. That's because the bladder and kidneys are part of the same system. If your kidneys are in distress, your bladder is one of the first places the signs will show. Sign number 5, swelling in your feet, ankles, or face. If your shoes are suddenly feeling tighter, or you notice your socks leaving deep marks on your ankles, pay attention. One of the key jobs of your kidneys is to flush out excess fluid and waste. But when they're not working properly, that fluid doesn't go anywhere. It builds up in your body. The result? Swelling, often in your feet, ankles, legs, hands, and even puffiness around the eyes or face. This swelling, known as edema, isn't just cosmetic. It's a warning sign that your body is holding on to toxins it can't get rid of. Sign number 6, constant exhaustion and brain fog. Let's face it, everyone feels tired and foggy once in a while. But if you're feeling completely drained and unable to focus, even after a full night's sleep, your kidneys might be to blame. Healthy kidneys produce a hormone called erythropoietin. Sounds complicated, but it has a simple and vital job. It tells your body to make red blood cells, which carry oxygen to your muscles and brain. When kidney function drops, so does this hormone. Fewer red blood cells equals less oxygen, and that means you feel exhausted, weak, and foggy no matter how much rest you get. This kind of fatigue isn't just being tired. It's your body running on empty. Sign number 7. Feeling cold all the time. If you're constantly cold, even in warm rooms, your kidneys could be behind it. When they're not functioning well, it can lead to anemia, a condition where you don't have enough red blood cells to carry oxygen throughout your body. Without enough oxygen, your body struggles to regulate temperature, and you feel chilly all the time. On top of that, if the cause is a kidney infection like pyelonephritis, you might also experience fever, chills, and sweating, symptoms that can easily be mistaken for the flu or another common illness. Sign number 8. Itchy skin or strange rashes. A little itching now and then? Totally normal, but persistent, intense itching, especially when it's not linked to allergies or dry weather, could be something deeper. Your skin is often a mirror for what's happening inside your body, and when your kidneys begin to fail, they can't properly filter out toxins. As a result, waste starts building up in your bloodstream, and one of the first places it shows up is on your skin. You might notice dryness, rashes, or constant itchiness that just doesn't go away, no matter how much lotion you use. Sign number 9. Bad breath with a metallic twist. When kidneys fail to filter waste efficiently, urea builds up in the bloodstream. That urea then breaks down into ammonia, which can leak into your saliva and cause what's known as ammonia breath, a distinct smell similar to urine or chemicals. Many people also report a metallic taste that lingers no matter what they eat or drink. It can mess with your appetite, distort the flavors of food, and leave you wondering why everything suddenly tastes weird. Sign number 10. Frequent nausea and vomiting. If you're feeling nauseous more days than not, or you're vomiting with no clear cause, your kidneys might be behind it. When your kidneys begin to fail, they can't filter out toxins like they should. As those waste products build up in your bloodstream, your body starts looking for any way to get rid of them, often through the stomach. This toxic overload can trigger ongoing nausea, frequent vomiting, and a complete loss of appetite. Suddenly, even your favorite foods might turn your stomach. Sign number 11. Shortness of breath. Failing kidneys can lead to fluid buildup in the lungs, making it harder to breathe. On top of that, if kidney disease has caused anemia, your blood may not be carrying enough oxygen, which means your muscles, brain, and lungs are working with less fuel. The result? You're left gasping, fatigued, and wondering why simple activities suddenly feel like workouts. Let's be clear. Just because you're experiencing one or more of these symptoms doesn't automatically mean you have kidney disease. These signs can overlap with other health issues too. But your body is always communicating, and when multiple symptoms show up together, it's worth listening. Talk to your doctor, ask for tests, take action early. Because when it comes to your kidneys, early detection can mean the difference between manageable treatment and irreversible damage. If you found this video helpful, give it a thumbs up and subscribe for more clear, practical health tips every week. Thanks so much for watching, and take care of those kidneys.